magic. It's way lighter. Walking is more like enjoyable.
Welcome to the office.
Welcome, Christian. Welcome.
Thank you for receiving me.
Where are you coming from?
I'm coming from Spain,
What part of Spain?
near Madrid,
All right.
like more or less in the middle.
Why are you coming all the way from Spain?
Well, I have some issues I have to address.
Okay.
Should I just
Just share your story.
share my story? So there is
You're
this
coming.
day-
You're coming a long way, man. all
Yeah,
the
I
way
know.
from
I know. I
Spain.
have like I'm very positive,
Okay,
so I'm
good.
thinking about my my well-being. So
Okay.
I'm trying to be better
Okay.
in general. So there is this day where actually I haven't had like a proper dinner, suppose this day. So in the morning I was super hungry and I hold on to it because usually I have breakfast on my job. So I just took the public transport, and in my last station I started to feel funny, like sweat in my hands
Okay.
in my forehead, and I lost my conscience. I fainted. Well,
When was this?
5 years ago, and I lost my conscience, and I fell on my left side. So I had this fall, and then when I woke up, I was like trying to walk naturally, and I was having this problem with encounter my balance, having my balance properly in the place. So I was thinking about the steps I was doing. That was quite unusual, was weird. And the paramedics came as well. They checked me out, and at that moment they didn't saw anything. And I just keep going with this problem. So I just went to a bar. I had a breakfast, and I started having this nausea.
You eat breakfast at bars?
At
in
the
Spain?
bar, I didn't went to my job because I didn't feel great actually. I
Okay.
start like I wasn't feeling great, and I had this breakfast, and I was feeling funny. I was feeling like nausea again, So I actually throw up my breakfast,
Mhm.
and I went directly home. And when I went home, I start like my heart was kind of working harder than usual.
You could feel a strong beat.
Yes,
Okay.
and faster. And I was just going up on my 4th floor, I think it was. Yes, yeah. And I went directly to my bed because I actually wanted to sleep.
Mhm.
So I usually sleep on my left side, and I just try to go on my left side, and after 5 to 10 seconds, I have this horrible vertigo and pain around my left side of the neck,
Mhm.
a lot of pain and muscle spasm, pain and vertigo. After
Okay.
5 to 10 seconds, staying on my pillow, the same pillow, the same, same scenario, same how to say it.
Everything's the
Same-
same as
yeah,
the day before, as you
Yes,
do every
everything
day.
was the same. It
Okay.
just changed everything with the fall and with the situation I was in.
Okay.
And I had this horrible vertigo and issues on my left side. So I had to switch immediately to my right side because my body actually relaxed, like start to relax on my right side. Everything was normal.
Okay.
So I start sleeping on my right side. And after 4 to 5 hours, I was just I woke up all of a sudden, and my heart was going crazy, like bum bum bum, very hard.
Mhm.
And at that moment, I didn't knew what happened to me, like what was the problem, and I stayed like 1 month with the same
You
issues,
didn't
and I
see-
went.
Hold on, you didn't see anybody?
I didn't see anybody.
Why?
Because I was kind of scary of losing my job if I was going to a doctor and they see some issues, and I have some confidence in that.
Yeah.
So I just hold to it. I hold like one month more or less, and I went to the emergency room, and they did like.
Hold on, you were scared that you would lose your job if you went to the doctor and they found something.
Yeah, it's if I had some issues I might have problems with my job
Interesting.
because I was like in my this was actually a new job, so I was like 1 year in, so I
Right.
didn't want to have any
I got
problems
it,
with
okay.
anybody, so I just hold.
How
to
many
it.
times have you told this story to people, doctors and therapists?
They actually cut me up, like they didn't actually hear the whole story.
Okay.
The thing is, I start to explain my story, and they just stop me and they let me check you out. They give you a pill and a prescription, a drug like a pill, and then you just go home, and that's it. So I went to cardiologists as well. I went to the emergency room. They did like a TC on my heart to see if everything is fine because of the blood pressure. I had like 160/100, like that was high. And I think, yeah, so after that, they gave me another pill like for sleeping, drugs for sleeping, because I had issues with my sleep, because on my left side, every time I went to my left side, I had this weird vertigo and issues with muscle spasm and pain and blood pressure for about 2 years. And after 2 years, this problem. And after 2 years, the vertigo stopped on my left side. Right now, I cannot even stay on my left side. I try to stay on my left side, but it's super uncomfortable.
But
and
there's no
it's-
vertigo right now.
There is no vertigo,
How
but
about
there
on
is
your right
pain.
side?
On my right side, it's a little bit more
No
comfortable.
vertigo?
No.
So vertigo is not there anymore?
After 2 years, the vertigo was gone,
Okay.
but I still have the problem with the muscle tension and the pain on my left
And
side.
what about the heart?
And the heart is, I don't have like 160/100, I only have 145/95.
That's blood pressure, but
Yes.
what about the pulse, the beat, the strong? Is it still strong?
Yes, still strong,
Yeah.
but it's not that quick anymore.
Correct, because your
And I
body has
have,
adapted. Have you seen anyone though after? So you've had any treatments to figure it out? You saw cardiologists and all
I
these
saw
people.
two cardiologists. They did a TC. They did 2 TCs, 3D images of
Yeah.
my heart, and then I went 6 months to a physical therapy, and it was like it was quite like temporary. It didn't fix the problem though, with the sleep and with the.
Did anyone
blood
tell you
pressure.
what your problem is?
Not really, no. They say I just fainted and I had a low sugar in my blood, and it's from that. But they didn't explain why I do have these problems and why I do have this tension and pain, and because my body right now is kind of used to the pain.
Yeah, you've been
If,
bad, it's 5 years.
It's if I have more pain, I notice it. Like right now, I have some pain because I do walk a lot. I try to walk a lot, and with the walking, I just have this
Okay.
pain in my lower back. After 2 years, I started getting my lower back issues.
Sure.
I never had like a problem in my entire life. I was sleeping fine. I had no pain in my body because I suppose I'm compensating or something, but.
All this because you missed breakfast.
All this because because I just hold to it and I just fall. And when you fall without conscience, your muscle doesn't,
Right.
how to say,
So what are you doing here, dude? What am I gonna do for you?
I'm trying to sleep, I'm trying to seek like a better sleep
Okay.
and better like try to correct why I have this pain in my neck.
Okay.
Especially at the top, this pressure that sometimes come with, very rare, but it comes with nausea. And I have this, sometimes the heartbeat is in my eyes as well, sometimes, with the blood
you
pressure.
feel the pulse, right?
Yes, I feel the pulse, the pulse, that's correct.
I got it.
I explained this to the doctors in Spain, and they say I'm crazy.
Yeah.
Yeah, but I'm not crazy.
So
It's
the
what I-
correlation it actually comes from the carotid sinus and the heart. And when that beat is so intense, it can be a couple of different things. I've seen it, I've heard it. And one is, if this thing is pounding so hard, is it that he's feeling it in the eye, or is it the perception of the connection? That's one thing. The second thing is, if that's happening, everything he's describing to me is, I'm thinking vagus nerve. Everything I'm thinking right now, what you're describing, here, eyes, this, heart, all of this is all, I'm thinking vagus nerve.
My eyes are quite dry as well. My eyes
Dry,
are very
right?
dry, especially in the morning. Like it's very hard to open them up.
I got it. And how about your energy levels in the morning?
Oh, I'm very fatigued always. I don't
Takes you
really
an
rest.
hour or two to get going when you wake up, or
even,
more?
Even more.
Okay.
Because I usually sleep like 4 to 5 hours more or less.
Okay.
But it's like a safe mode sleep. It's not a resting.
I understand. You're not getting true REM sleep. You're getting just kind of like it's easy to wake up.
Yeah, I mean, it's like I don't like I sleep, but I don't sleep. It's I wake up the same, with the same kind of energy, and I try just to keep going forward and smiling and whatever. But it doesn't really helps
Okay.
me out.
You're working right now.
Yep.
Your family knows you're here.
Yep.
Okay. All right.
They know.
Okay, so here's the deal. Let's figure out what's going on in terms of the imbalance in the nervous system first, okay? I'm hoping while you're here this week, you go home or back to your room and just pass out for a long time. Okay, I'm hoping you get,
I hope.
and
I
if
don't
you
get
do
arrested.
that, it's a good sign. Okay, I've had people tell me, after that adjustment, I just went home and wanted to pass out. And some people told me for 2-3 days they wanted to do that. That means your body wants the rest, and now it's ready for it. Okay, all right. You've had x-rays before?
Yeah, but not by chiropractic
That's all right.
itself. Just on the emergency room, I think they took
Okay.
X-rays.
All right, you ready to get started?
Of course.
Is there anything else you need to tell me before I start?
About my condition.
Anything?
Oh, my jaw popped after 2 weeks. 2 weeks after the accident.
That was all 5 years ago. I'm talking what's going on today, dude.
Oh, today.
'Cause
Well, my
the other thing is, you're in your story from 5 years ago. You understand what I'm saying? We need to get out of that story.
Well, I'm trying to share it.
No, but I'm saying is, one thing I want you to realize this week is
Yeah.
as we're going through it,
Okay.
and you're telling me the story of what happened, but as we go through, we want to let go of that
Of
story.
course, yeah.
Okay, that's what I'm hoping for you. Number one, and number two is you get good sleep.
Yeah, that's very important.
Yeah.
It's the most important thing right now.
Okay.
Sleep and I think because it's my body's in stress and it's the pain I still have it, the pressure I still
Right.
have it doesn't really let me just relax. and
You
sleep
ready to get
properly.
started, dude?
Yeah. of
Let's get
course.
started. Okay, take your glasses off, please. And the first thing I want to do is just check his eyes. Keep your knees together. And I'm checking for the pupillary light reflex. I'm going to shine a light in your eye, okay? And I'm just looking to see that it constricts. Your pupil should constrict for 20 seconds. We're going to start on this side here, Shasha. Okay, make sure you can see it. This is the left eye. 1, 2, 3, 4, 5. It's pulsating at 5 to 6 seconds. Now on this side, we're going to go to the right side. Let's see. 1, 2, 3, 4, 5, 6, 7. Starts to pulsate at 7. So what I'm testing indirectly is what's called the adrenal response to the pupillary light reflex. And I'm looking, if that thing doesn't hold down and constrict for 20 seconds, the way the eye actually does it through light stimulus is through the hormone epinephrine. Epinephrine is made, it's the epinephrine response, it's made in the adrenal glands, causes the eyes to constrict. So we know there's some adrenal fatigue, and I was asking you, you wake up in the morning, it takes you a couple hours to get going, right? That's related to the adrenal system. Okay. All right, shall we go over your x-rays?
Yeah, of course.
Come over here, please. This is you. This is a picture in time. This is your full spine x-ray. This is your AP x-ray. This is looking at you from behind. This is the right side there and there. This is your side profile. And we're looking at a few things. We're going to go over this x-ray first, and we're going to talk about your posture and your curves. And so first thing is we're running a posture line. When we run the posture line, we're running it from the lowest lumbar all the way up, which it should bisect the base of the neck and C2. So your curves are actually good. Your curvature is good, so I'm happy with that. 2, 3, 4, 5, 6, 7. So the line should theoretically go through here. It's going through 6. It's slightly off, but overall, your curvature is good. That's the first good news. Second is, let's look at your posture is good. Curvature-wise also, when we're looking at the curve, do we have the right 60-degree curve in the back, mid-back, and neck? Overall, like I said, overall your curve is decent. Your discs are good. This one, they should be level and parallel. When we're looking at the discs, we're tilted at L5. 4 is tilted, 3 is tilted, 2 is tilted, 1 is slightly tilted, 12 levels off. So what this shows me, Christian, is all of this in your lumbar spine is compensating to whatever's going down in your tailbone. And the first thing I see is the coccyx. Okay, that's the first thing I see is we have a slight misalignment of the coccyx. Whether that was from the fall or that was prior, I don't know that.
Maybe prior.
Regardless, we have to deal with it. Now, so we have something going on in the tailbone. As we go up, overall, your discs are good, discs are good, discs are good, discs are good. Discs are good. We start to open up a little bit in the upper neck here. I'll explain the significance of that in a minute. Now, here's the thing. Let's get to your neck. Your disc is good. Disc is good. It's tilting back a little bit, but here's what I see. I see C3 and C4. Okay, these two stand out, a little bit of C5. 3, 4, 5, that's the anxiety. That's the shortness of breath possibility. Now, as we go closer, there's a little lipping here at C4. It's been there longer. But now where I'm going to go is to the facet joints. The facet joints is that space right there, okay? And I'm looking at the facet joints. C2 has damage, okay, on the posterior facet. C2 there's some arthritis between C2 and C3 here. C3 is clear through the facet joint. C4, check this out. This is actually pretty interesting. So C2 is binding. We're going to have to deal with that. C3 is clear. C4 is binding. C2, C3, hold on. C4. Hold on. C2, C3, C4. And C4 is binding right there. C5 is clear. C6 is clear. You see how that space is open? That's all clear. This is C4. So C4 and C2 is what we have to look at before we even consider going to the atlas. Because we have an issue at 4, we have an issue at 2. We also have an issue up top, but we're not there yet. Okay.
I understand.
All right, C4 and C2. Now let's go down low to the basement and let's see. And I believe we will be starting in the parasympathetic nerves. So going back here, when we're looking at the tailbone, we can see this nub here. We have an issue at S3. We have an issue at S5 coccyx. That's what I see so far on this x-ray. Does that make sense so far?
Makes perfectly sense.
Now let's look at your AP and talk about your foundation. Because look, it doesn't matter what we have up in the penthouse. If we don't have a level base and foundation, ain't nothing gonna hold. So let's look at the basement now. Let's look at the foundation. This is good. You get it, dude. I mean, you traveled across the pond to get here, so you didn't just come from like
Makes
that.
common sense.
Right?
Yeah.
Now, let's look here. Yes, we see some curvature stuff. We have a rotated sacrum on the side of a rotated pelvis, drop 3 millimeters with a short leg on the left side. Let me put it together now. PIIN versus ASEX. The PIIN tells me it was a fall. However, you have at least 3 injuries in your back, not that one. So whatever that 5 year ago injury was probably a trigger of things that were already going on from before.
Makes sense.
Okay? Now, rotated sacrum, drop 3. This is what's happening. Left pelvis goes down PI, turns in IN. Sacrum on that left side goes back 7, down 3, and the whole thing is down 6. That's the imbalance. So we're going to start down low here, bring it up. We have to fix the rotation. 3 millimeters of this short leg is coming from your tailbone. Fixing your pelvis does not change this, but here's the good news. It's under 7, adjustments will hold regardless.
Yes.
In this work, anything under 7, normal variant. I'd be happy if we can get it up 1 or 2 millimeters, but I'm okay if it doesn't also, okay? From there, we can see L5 is off the first floor, okay? And if we look at the first floor, it's off, and now it starts to take the rest of the spine with it. Your Megan Blasi is decent, could be a little bigger, but decent. This is all undigested food going through your ascending transverse colon, descending, producing a lot of gas.
Wow.
So we will see the changes that happen in 1 or 2 visits. If we don't get it, I'm going to add something to speed up the process, something natural. So it curves to the left, comes to the right, curves again to the left. All of this is compensation. All of this is compensation. Same thing, you got a nice kink right here. 1, 2, 3, 4, 5, 6, 7. This is your digestion, stomach area. T4 is a side slip. T4 is something we're going to need to address. T4 side slip. And this T4 is also part of why this doesn't hold. T4 is your heart and lung. T4 goes up, 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 up. This whole thing curves. You see the whole thing bends.
Yeah.
Okay.
Yeah.
Now we get to the top, brother. And now we see what do we have going on here.
Teeth.
What? Yeah, we have the atlas off a little bit. But what I want to show you and you to understand is that atlas is tilting this way. It's compensating for this T4, which is compensating for this low back. So the majors I see right now, T4 and the sacrum. Those are the majors I see for right now. And let's see what unravels along the way.
Okay.
Fair enough?
Yeah, fair enough.
All right, walk to the corner of the room and back a couple of times. So as he's walking, he's just stiff. You're pretty stiff. I don't see no movement in there. Come here. Hold on, this is throwing me off a little bit. Let's hide some of this
I
stuff.
walk a lot though, but
Yeah, but you walk side to side. Watch this. They need to go up and down. Oh, you in for it. And have you always walked with your feet out like that?
no. I
Was this after the accident
It's
or
from-
recent?
after the accident I try to balance. This is the way I
Balance
try to
yourself.
balance yourself. Yes, myself.
Good. Walk it up
It's
good.
usually done.
And it's something I've talked about in past videos that when you see someone walking bilateral toe out, that's an upper cervical issue. The body's trying to keep balance. Walk one more time, please. So there's just stiffness and rigidity in his walk. I don't see him moving through his pelvis. I don't see him swinging his arms. Have a seat, sir. Let's take a look and see. Starting at the base. Head down, please. Starting at the base, 25, 30 points, dude. C4. Dude, that's off the chart. C4, 35 points. I think you got a record here, dude.
Really?
T4, 10 points. C4, T4. If I get an L4 or an S4, you're going to Vegas, baby. Sit up straight the best you can. So he's got a lot of.
So
He's
this
got
is
it.
like
He's got this
aesthetic
kyphosis.
practice.
If you look here, okay, sit normal, whatever's
This
comfortable.
is like
That's too much kyphosis. Touch your toes, please. Touch your toes. Bend forward. Go down.
Oh.
Touch your toes. All the way down.
Oh,
Yeah,
okay.
all the way down. So he's got a pretty good.
I have some
Sit up.
pain in my lower back right now.
Okay.
Stay like this.
Sit up straight. Okay. T4, 10 points. Oh, there it is. S4, S5. 10 points left side. Let's check the movement in your pelvis first. Feet together, sit up a little straighter if you can. And let's open and close the knees with your feet touching. Your feet are touching, open and close. Open and close your knees. Good. Right side only. When he does the right, the left wants to shift. Left side only. When he does the left, there's less movement on the right. It's a little more independent. So the issue is the left SI joint. Sit back for me, please. Now, what the book says, he's got a PIIN on the side of a rotated sacrum. The IN is the major. The book says to do the sacrum. Doing the pelvis will not change the hip height regardless, but we're still going to do the leg check. Here, let's do this first. That's 5, right there. Little tender.
Yes.
S1,
So a lot more.
S2,
Even more.
S3. Yeah, burn, baby. S4.
Wow. A
Ah,
little bit more.
S5.
It's oh my god.
Right there
4 and
or right there.
5 is even worse.
5 is worse. I'm gonna go on the outside of your underwear. It's actually down in your coccyx. That's coccyx.
Okay.
That's S4. Oh, we're gonna have some fun today, brother. T4,
Yeah, it's bad.
T5,
Four.
T4.
4.
Alright, so we have S4, coccyx, T4, and now let's check up top. Sit back for me, brother. Alright, here we go. 7, 6, 5. That's where it's starting, at 4. You crack your neck a lot, don't you?
It just pops. If I stretch it, it just pops.
3. That's 2.
Yeah, it's worse than.
I'm pushing a little firm. That's 3.
Okay.
And that's 4.
4. Oh, it's more like.
It's hypermobile, actually.
Ah,
Right
it
there.
hurt. Yeah, it hurts a lot right there.
S4, C4.
And the top is.
C2 we're going to get at, but remember what I showed you.
Yeah.
C2 has scar tissue in there to C3.
Mm.
C4 is the one off starting. So we get C4 moving. 4, 4, 4,
4.
coccyx.
Okay.
Triple 4s, baby. So we're going to start with your foundation before I touch anything else.
All right.
We're going to do coccyx on the right, sacrum on the... So this is going to be a little interesting combo, guys. I'm about to remodel his sacrum. De lado
Izquierdo.
izquierdo. Sí.
Oh, this is my worst position actually.
If you really can't handle it, tell me. It's going to be just a second, okay? You ready for me? Let's do it. And we got to bring it up. Gotcha. Other side, please. Right side down. Now S4. And we're going to do start S4 here as a rotated left, and then we're going to go on the ILO. Bottom leg straight. There you go. You okay, brother?
Yeah.
You're going to be all right, all right?
Yeah.
There we go. Nice and easy there. Nice. That's a piece. Come up slowly, please. Let's walk it off once. It's a little tense for me, but it's okay. We're gonna get through it. A little different, yeah?
Yeah, it's
A little different.
it's like
Something's different. Hold on.
It's more like a little bit more fluidity.
What?
A little bit more
Smooth.
natural. Yeah,
Yeah.
smooth.
No kidding. Come over here. Let's go face down.
It feels a little bit tempered. You know. It's,
Ruby! Face down, sir. And we're going to torque clockwise to bring it up. This way. This way. Relax the shoulders down, brother. That's a piece. Little more. Little more. There you go. That's the whole one. Thank you. T4.
No.
That's a piece. A little more. There you go.
That was tender.
Still more. Drop. Drop.
Oh.
Dude, you're fighting. There you go. That's a piece. Your body is in a lot of defense, brother. Wow. That's okay. Let's walk it off.
That was painful. A little bit more.
Walk it off.
Oh, that's different. I walk a little bit more relaxed.
Good. Walk one more time. Have a seat and let's work on C4. I'm hoping C4 is 1 or 2 adjustments and we can get to that C2 as soon as possible, okay? Sit back for me, please.
Oh, yeah.
All the way back. Excellent. Right hand up, seatbelt. That's to hold the upper thoracic, make the neck adjustment easier for us, okay? C4. There it is. Clunk. Like butter. Give that a second. That was a nice set. Walk it off 2 times, please. Nice. Is it me or is he starting to move his shoulders a little bit? He's starting to be a little more relaxed now.
Yeah.
Good. Awesome. One more time. And now let you wear your glasses now.
Thank you.
Carnalito, caminas por favor.
Yeah. I need to enter in heat. I need more
You're
heat.
getting some heat now, right?
A little bit.
A little bit.
My lower.
So, tell me what you're feeling.
I'm light.
Okay.
Yes.
One more time, and then have a seat. We'll recheck. Awesome. He wants to smile, but he's guarding because it's only the first adjustment. And that's fair, okay? Let's recheck. Starting at the base, head down. So 35 points is now 0. T4 is clear. I know it's cold, dude.
Yeah.
Bear with me, dude. Bear with me, brother. Sit up straight. Sit up. Bear with me, man. I know. It's a little. It's a little.
It's a storm.
That's all right.
It's a storm.
Check it out. Sacrum is clear. You're all clear, brother. Sit straight the best you can. Back towards me. 5, 1. You remember?
Mm.
2. Different?
Yeah, different.
3,
It's different. Yes.
4.
And it's
You were screaming when I did that.
it's a little bit less, but I did feel some how to call it. I don't know how to call it. Yes, a little bit. Yeah.
Yeah, but it's different,
Yeah.
right?
Yeah. Different. I mean, it's not that painful.
Sit up straight. Ears. Shoulders. Oh. That was not my knuckles, guys. Shoulder. There you go. Boca arriba.
Oh, see.
I'm going to tune up your ankles now, and then you're going to get the buff and polish. Raise the right leg up, AS talus. Left leg up. I hope you brought some winter clothes, dude.
I do
You
have.
need to walk a lot while you're here. Sit up for me and turn.
I know, I usually walk a lot. But you know, the thing is with the walking, like if I do more than 3 miles, I started to have these issues on my lower
Well,
back.
right now, just focus
So-
on half an hour walks, okay?
All right.
Head down and up, down and up. That's totally different. Nice. Buff and polish, sit up straight.
Oh, I'm starting to feel the heat now. The heat in my neck. It starts. Yeah.
If anything is too much what I'm doing, just tell me to
Oh,
stop.
it's okay. Oh,
There you go.
all right.
Spicy,
A little bit.
picante, poquito. Tickle?
Yeah,
Tickle spice.
it does.
Good, 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 good.
Uh,
Now let's go down low.
oh, I do feel the heat in my neck now. There is some heat there right now. Should I ice? I don't know.
Walk it off right now. Check it out. Now walk 2 times and
Oh, let me like a second to
I enjoyed it.
recalibrate or something.
This is after all the adjustments.
It's different. It's way lighter. Walking is more like enjoyable. I feel like it's a few steps, and I'm like, I could walk even faster, you know. I'm just
Well, this is gonna be, you're gonna have an interesting day today to tell us.
usually I got like in these joints. I have some pain around this area, in my lower back. But now it's like
Stand over here and let's check the hands, please. Squeeze slowly. Squeeze. Relax. Squeeze. Elbow. Relax there.
surprises.
Squeeze now. Good. Squeeze. Elbow. Ulna. Lunate. Scaphoid. There. Squeeze.
Oh, more firm.
Squeeze.
Yeah, I know.
Squeeze.
This is magic.
It's not magic.
No, it's definitely.
Magic is an illusion.
Yeah, I know.
This is real.
But this is kind of happiness right now.
Good.
It start to just feeling great. I'm starting like, oh, the neck is lighter as well.
Look this way all the way. Look this way all the way.
Oh, it feels different. Yeah, it feels a lot different.
Welcome to the office.
Thank you for receiving me.
You're welcome.